Hello everyone, welcome to NGR 6367 deliverable 5 on already brief. This deliverable has a lot of things inside because time will not permit me to go around on all the discussions. The patient clinical outcomes and symptoms supported the diagnosis of bacterial vaginosis. The diagnosis was confirmed by her history and the use of AMSA criteria, elevated pH, presence of blue cells, and characteristic odor. Metronidazole was chosen based on its established safety in pregnancy and documented efficacy for treating bacterial vaginosis. Despite a negative urine pregnancy test result, the diagnosis of early pregnancy was confirmed by serum HCG levels, emphasizing the importance of diagnostic consideration when there is a significant clinical suspicion. Choosing metronidazole also necessitated paying attention to psychiatric medication, sertraline and mirtazapine, which needed continued mental health support. Although they do not interact with metronidazole, because pregnancy can cause mood changes because of hormonal changes in stress, a proactive psychiatric referral is suitable. If mood disorders are not treated during pregnancy, the mother's and the baby's health may be harmed, leading to low birth weight and preterm delivery. Education on non-pharmacological approaches is equally vital. Improper vaginal hygiene practices, including douching, predisposing patients to recurrences. Patient counseling regarding good hygiene practices, breathable underwear, and probiotics align with standards of practice, though more research is needed. Evidence supports that lactobacillus probiotics may help restore normal vaginal microbiome and prevent bacterial vaginosis from recurring. Advanced maternal age and unusual menstrual cycle mean there was a greater risk of gestational hypertension, preterm labor, and malformations of the baby, which necessitated consultation with obstetrician gynecologist. Early prenatal care ensures that screening is instituted early and that the pregnancy is dated correctly so that any complication that may arise can be tackled. Follow-up visit also serves to ascertain resolution of PV, DV, and strengthen strategies of health maintenance. Now the applications. This case required integration of complex information from various domains: reproductive health, psychiatric, and diagnostics. Serum HCG was ordered due to a strong clinical suspicion of pregnancy and an understanding of the sensitivity of the test. This showed a deeper appreciation of laboratory diagnostics in conjunction with knowledge of the limitations of point-of-care testing in early pregnancy. In addition, treating bacterial vaginosis for pregnant patients is critical, unlike in non-pregnant women. If bacterial vaginosis in pregnant individuals goes untreated, it can result in problems such as premature birth and postpartum infections. This enhanced susceptibility supports the significance of timely and complete treatment. The patient's psychiatric comorbidities introduce further complexity. A stable regimen of sertraline and mirtazapine require careful evaluation, not removal. Appropriate discontinuing antidepressant during pregnancy can not only cause worsening symptoms but ultimately lead to harm for both mother and fetus. Advanced practice nurses must be prepared to evaluate the risks and decide the best course of action based on available literature, applicable recommendations, and the unique context of the patient's history. The multi-user nature of the treatment plan, OB referral, mental health follow, or patient education illustrate how advanced practice requires more than disease treatment. It involves system-level thinking, coordination of care, and preemptive risk management. Case. How this case expanded practical experience. This case provided a valuable learning opportunity distinct from prior experience. In previous cases, I managed BV in non-pregnant women without complicated psychiatric or obstetric consideration. To create a solid plan, I had to consider and match the different reproductive psychological diagnostic issues. It was especially enlightening to learn how psychiatric medication must be considered carefully in pregnancy instead of modifying or stopping medication without thought. I was able to go from symptom management to whole patient care, considering mental health, pregnancy status, and long-term risk. In conclusion, this case underscores the value of thorough and patient-centered approach BV management in the context of early pregnancy. Thank you for listening.